Hi everyone, welcome back to my YouTube channel. Today we are going to talk about intracranial hemorrhage, and here at the side you can see the diagrammatic representation showing different types of hemorrhage for the reference. So let's start our topic with introduction. An intracranial hemorrhage is bleeding that occurs inside the cranium, either within the brain tissue itself or in spaces between the brain and skull. It can result from trauma, aneurysm, hypertension, or blood clotting disorders, and may cause increased intracranial pressure, herniation, or stroke. Talking about types of intracranial hemorrhages are epidural hemorrhage, as you can see here in the diagram, subdural hemorrhage, subarachnoid hemorrhage, and intracerebral hemorrhage, that is also called as intraparenchymal hemorrhage. Now let's talk about these types one by one. First, we will talk about epidural hemorrhage, that you can see here in the diagram. Location between the skull and dura mater. Cause is usually traumatic, often from rupture of middle meningeal artery due to temporal bone fracture. Clinical features. First, brief loss of consciousness may be there, followed by lucid interval, then rapid deterioration. Symptoms include headache, vomiting, and signs of brain herniation. Shape on CT scan, it looks like lens shape or biconvex hyperdensity. As you can see here in diagram, it is also called as extradural hemorrhage. Urgency. Neurosurgical emergency is this, and often it requires surgical evacuation. Second type is subdural hemorrhage. Location is between the dura mater and arachnoid mater. Causes are mostly tearing of bridging veins, often due to trauma, especially in the elderly or alcoholics. Clinical features include gradual onset over hours to days or even weeks. That is the chronic form of the subdural hemorrhage. The symptoms can include altered mental status, headache, and focal neurological deficit. Shape on CT look like crescent shaped hyperdensity that spreads over the brain's surface. Management is by observe and surgically drainage depending on the size and symptoms of the subdural hemorrhage. Next type is subarachnoid hemorrhage. As you can see here in the diagram, its location is between the arachnoid mater and pia mater in the subarachnoid space. It is mostly caused by rupture berry aneurysms that is non-traumatic, or there may be the trauma may be the cause. Clinical features are sudden severe thunderclap headache, that is worst headache of life. There may be neck stiffness, photophobia, nausea, and possible loss of consciousness. Diagnosis is by CT scan and lumbar puncture if CT scan is negative. Complication, there may be rebleeding, vasospasm, and hydrocephalus. Treatment is by supportive care, surgical clipping, or endovascular coiling of aneurysm. In further types, we have intracerebral hemorrhage or intraparenchymal hemorrhage. Location within the brain tissue itself is this the intracerebral hemorrhage. Causes include hypertension, that is the most common cause. Arteriovenous malformation may be the cause. Cerebral amyloid angiopathy, mostly in elderly, is the cause for the intracerebral hemorrhage. Trauma, tumors, and anticoagulations can also be the cause of intracerebral hemorrhage. Sites are mostly basal ganglia, thalamus, cerebellum, and bones. Symptoms include sudden neurological deficit, headache, vomiting, and altered consciousness. Management is by supportive care, blood pressure control, surgery, and in some cases is also required. Clinical features of intracranial hemorrhage, they include increased intracranial pressure that can cause headache, vomiting, and decreased consciousness. They can cause neurological deficits that are include hemiparesis, cranial nerve palsies, and visual disturbances can be there. There may be seizures that are especially with cortical involvement. Cushing triad is severe cases. It can cause bradycardia, hypertension, and irregular respiration. Now let's talk about diagnostic tools for the intracranial hemorrhage. They include CT scan, that is non-contrast. It is first-line imaging that is highly sensitive for acute bleeding. Then there is MRI, that is better for subacute chronic bleeding and deeper structure evaluation. Then we also can do lumbar puncture, that is used when subarachnoid hemorrhage is suspected but CT is negative. Now let's talk about prognosis and management of this. Time is brain. Prompt recognition and intervention are crucial for the management of these fractures or traumas or injuries. Supportive care as a necessity, airway, blood pressure management, and seizure prevention include supportive care. Surgical intervention, there may be necessary for evacuation or compression. Rehabilitation is often required for neurological recovery post hemorrhage. Now let's talk about conclusion of this lecture video. Intracranial hemorrhages are urgent high-stakes events when location determine lethality. Even type paints a different clinical picture, but all require quick recognition and management to prevent life and neurological functions to be destroyed. And this was all about intracranial hemorrhages. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.